You see those lines in here? This is a struggling bladder that's been working too hard, pushing urine through a tight donut hole. We do not want to see these lines. We call these trabeculations within the bladder. That is a sign of a struggling bladder. So once again, we do not want to see all of these signs of a struggling bladder called trabeculations. Welcome to BPH 360, where bladder health matters. I'm Dr. Wayne Kuang, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions, take control. For education only, not medical advice. For your care, consult your doctor. Today, let's talk about the 5 stages of bladder health. Why do we even need it? The issue is that too many men suffer from IFS, I'm fine syndrome, where they keep telling themselves, I'm fine. It's not that bad. It's just part of getting older. It's just normal aging, and I can live with this. I'm that tough cowboy archetype, and I can grit through it. Men will do their very best, wearing that armor of masculinity, not to confront what's right in front of them unless we clearly define in concrete terms the severity and urgency of the problem. Words matter. Words shape our thoughts, which shape our actions and our habits. One of the most powerful words that we have in medicine is stages. We know that from cancer care, breast cancer, prostate cancer, colon cancer, early stage, late stage disease. Stage quickly allows us to know where we are in this continuum for diseases that progress. And BPH is one of those diseases. We now know that for most men, there's a certain rhythm, a certain paradigm that men most commonly will go through. And we're going to talk about that today. And please recognize that together, when we start communicating in this way between ourselves, our friends, with our urologist, with our primary care doctor, we can then understand where we are now, where we might end up in the future if we choose not to do anything, and then we can agree upon what type of data we need to make better decisions to prevent those long-term stages, those end-stage diseases of a dead bladder, a leaking bladder, a bladder that keeps making you go to the emergency room because you can't pass your urine at all and you need a catheter in the penis to drain all that urine. So please, this is a language, and it's very important that we start using the correct language. So for example, when we talk about BPH in previous episodes, I want you also to be thinking about a different term, prostatic bladder obstruction, PBO, because now, remember, we understand it's the prostate, prostatic, that's the root cause of the problem, and it's causing an obstruction. That's the problem that we have to overcome, and it's putting the lifespan of a very important organ at risk, and that is your bladder. So together, let's start using the correct language, and we can start helping each other help your bladder so you can live the best version of your life. Let us review. As you can see on the screen now, this is from a previous episode. This is your prostate, as if you were looking down from within the bladder, looking at the prostate. And you can see here the donut hole of the prostate. That is what your bladder's having to squeeze and work harder to squeeze urine through this tight little hole. Then we also remember that it's not just about the size of your prostate, it's also about the shape of that donut hole, and that it's not as simple as a straight shot through. We talked about how in models, we often will see this model where it looks like the urine is passing straight through the prostate donut hole and then goes out through to the penis. But in truth, as we can see on this screen here, as this prostate has grown tighter, the donut hole is not straight. It's not a straight pipe. It has this hill that the urine has to go over. It then hits this wall and then has to go down through a very tight channel due to the constriction of the prostate, and then it has to make another turn to go out to the penis. This is such an important message that we wrote a review article that was published in November of 2025 in the journal Current Urology, a peer-reviewed journal, called Tackling the Progression of Benign Prostatic Hyperplasia, benign prostatic obstruction, because it's a progressive disease. And we are talking about how do we intervene or deobstruct? How do we open up that prostate donut hole within the window of curability, which we've talked about in the past? It was important for us to communicate to all the urologists at a high level what we think is going on that you know to be true, that BPH, PBO, prostatic bladder obstruction, is a progressive disease. And it can start once again with that donut hole tightening up, changing shape, obstructing the outlet of the bladder. So the bladder now has to work harder. And as that bladder starts to work harder over 5 years, 2 decades, it responds by initially adapting and compensating, but then it can start to become very reactive, quivering, struggling. It becomes irritable, causing those symptoms of urgency, frequency, getting up in the middle of the night to pass your urine. And then sometimes guys will lose control of their bladder. The bladder will become rebellious, squeezing without your permission, causing leakage, staining your urine, causing a wet spot on your jeans. And then over time, it can even get to the point where it struggles, can't work at all, or it even begins to lose its function and begins to fail. And that progression exactly reflects what many men experience themselves. Now, every man's different. Some men may skip certain parts of that progression, or parts of those symptoms from different stages may coexist at the same time. But overall, most men will follow this series of progressive symptoms and signs, and we all need to be attuned to it. Now, Man vs. Prostate wanted to give this a little bit more structure, wanted to give it a linguistic framework, and that's why we came up with the 5 stages of bladder health. And you know better than most people out there now that it's not just about your prostate size, it's about the prostate shape and, most importantly, your bladder function. How is your bladder working? Is it struggling? How is it coping? Is it weak? Is it strong? How long has it been having to endure these symptoms? Is it still at the point of compensation where we can try and intervene and have some success, or is it already becoming to decompensate where the chances of success are going down if we intervene too late? The 5 stages are a communication tool. Not every man needs to fit into a certain rigid box. It helps to tell a story and helps every man know exactly where they may be in that story. And it helps empower men, empowers you to decide whether or not you want to take action, whether or not you want your data from diagnostic testing to prevent you from getting to later stages of disease. It also helps you and your doctor team, your urologist, to be able to have the same language so you guys can work together as partners, stand shoulder to shoulder, and find solutions, find management strategies, treatment options together. Once again, it can help show everyone where you are now. What direction are you heading? Are you getting worse? Are you getting better? What data do you need? What parts of your bladder function are still salvageable? What can be preserved? What parts of your life can be improved so you can enjoy the rest of your life without leakage, without running to the emergency room? For you to make these best decisions for your life, learn more about the 5 stages of bladder health. There's an ebook version on Amazon, as you can see here on the screen, and it's just a plain spoken way to talk about these 5 stages. Now, at a higher level that we share with other urologists, with academics, you can see on the screen now that we've been able to depict the 5 stages, showing them go from stage 1 to stage 2, 3, 4, and 5. And it's this progression over time with increasing severity and urgency to do something about this disease process before it is too late. As a quick review, remember the bladder is one of the most complex organs in our body. It's so complex that other than the brain, the bladder is the only other major organ that cannot be transplanted. It requires a very high-level, sophisticated integration of your brain, the bladder, your spinal cord, all those nerves from both sides to your bladder, your prostate, the pelvic floor. So many moving parts, so much complexity. The bladder has 2 major functions. It's to fill up with urine and store that urine without giving you strong senses of urgency or making you to go use the bathroom frequently. And only when you deem it appropriate will you then allow your bladder to empty. the second function. So filling and storing and then emptying your bladder at the right time with good flow without causing stress on that bladder muscle because the donut hole is open enough. And that's what normally happens. Now, for the 5 stages of bladder health, it's also important to make an analogy to your heart. Just like the heart is a muscle that pumps blood, the bladder is a muscle that pumps urine. And remember, the key differences between the bladder and your heart is that your heart actually, to a degree, enjoys working harder, right? That's why we go for a run 3 miles a couple times a week. And we like that muscle to become stronger so that we have good cardiovascular health. And actually, if we look on the inside of the heart, you'll see these lines on the inside. Those are where the muscle fibers are getting stronger. And yes, we want to see those things and see the muscles being healthier in the heart because that's a sign of good cardiovascular health. The bladder is a very kind and gentle organ. It doesn't want to fight and it wants peace. It just wants to do its job simply and easily. Occasionally, sometimes it might have to work a little harder, maybe has to hold a little bit more urine than normal. But in the overall, it does not want to get to the point where it's struggling and working hard. And you can see that here. You see those lines in here? This is a struggling bladder that's been working too hard, pushing urine through a tight donut hole. We do not want to see these lines. We call these trabeculations within the bladder. That is a sign of a struggling bladder. So once again, we do not want to see all of these signs of a struggling bladder called trabeculations. So yes, the heart is a muscle that pumps blood. The bladder is a muscle that pumps urine through that prostate that starts off about the size of a golf ball. And we've seen this one before, right? This is a 15-gram prostate of a young man. And as we get older, these prostates get bigger. And they can get even much, much bigger. But yes, they starts out about the size of a golf ball in the shape of a donut. And we've talked about how as that prostate gets bigger, the donut hole is going to get tighter, causing things to slow down. And we can see that here, stage 1, things slow down. Now, 5 years, 10 years, 15 years, 2 decades, that bladder muscle is now working harder and harder, having to squeeze urine through that tight donut hole. And as a result, it struggles, quivers, and becomes overactive, causing urgency, frequency, getting up in the middle of the night to pass your urine. And we can see that here, stage 2, overactive bladder. If you don't take care of the problem, the bladder can then act out without your permission, like a rebellious child, and actually squeeze and contract when you don't want it to, when it is not socially appropriate, when you're out at the store, when you're at work, and cause you to leak urine, drops, squirts, sometimes completely all of your urine down your leg, staining your jeans or your pants, or now you have to start wearing incontinence absorbent pads that you find at your local store, or even a diaper, and that's not okay. And we see that here in stage 3, the rebellious child. The fancy word there is going to be urgency incontinence. And then if we really don't take care of the problem, just like the heart can have a heart attack, the bladder can suddenly stop working and you show up in the emergency room because now you have 2 liters in your bladder and it hurts. It's uncomfortable. You can feel the lower part of your body filling up with urine, backing up. And we haven't talked about it before, but rarely, but possibly, can actually begin to affect your kidney function if you don't take care of this. And as a result, it becomes an emergency. You have to rush to the emergency room after calling an ambulance and then have them place a catheter into the penis all the way up to the bladder to empty out all that urine. And we can see that right here. We've seen this diagram. They have to pace a catheter down through the penis, through the donut hole, up into the bladder to empty the urine out. And we see that here as stage 4, the heart attack. We call that, medical terms, acute urinary retention because it happens all of a sudden and you can't empty your bladder and you are retaining urine behind in the bladder. And then stage 5. Just like the heart can go into heart failure, the bladder can go into bladder failure. And now you're faced with the lifelong struggle of having to deal with catheters, either placing catheters into the bladder several times a day to get all the urine out because the bladder has died, it's failed, or potentially even having a catheter in place in your penis, draining the bladder continuously 24/7, 365, and that's not okay. And we call that stage 5, and you can see that here, heart failure stage. Similar to the heart, the bladder can also fail. Worst case scenario, the heart can still be transplanted. The bladder does not have that option. You only get one of these bladders per lifetime. You can't replace it. So please, that's why we're talking about this. We do not want you to get into these late stages of bladder health because often the damage can be irreversible, and we want to catch you earlier on before that happens and find management strategies, treatment solutions so that you can live the best version of your life. Something to understand is that this is just a linguistic paradigm, framework. These stages can coexist. So there can be men who have slower flow in stage 1, but also have urgency, frequency, getting up at night of stage 2. Or for example, you could have stage 2, urgency, frequency, nocturia, but you're also leaking, consistent with stage 3. The transitions of this staging system are not distinct. Every man's a little bit different. They move through these stages differently. Sometimes stages are skipped. Sometimes stages can coexist. We're trying to tell a story that we see very often with many men around the world. And now we can start to communicate clearly with our urologist. Where are we now? So maybe I'm here in stage 2, urgency, frequency. And the goal is not to get to stage 3, 4, and 5. So working with your urologist, what do we need? What data do we need so we don't get to these later stages? To give you a visual, why do we have this linguistic framework, the 5 stages of bladder health? Stage 1, things slow down. Stage 2, an overactive bladder. Stage 3, a bladder, a rebellious bladder that's causing you to leak urine. Stage 4, a bladder that stops working, causing you to go into retention and visit the emergency room. And stage 5, a dying bladder, a bladder that's failing, causing a lifelong use of catheters. Well, if you look at this image right here, this is from a pathology specimen. This is a man who died with a bladder that was highly dysfunctional. How do we know that? Take a look at the bladder. It's been opened up, and you can see here, look at all of these thickened fibers, muscle fibers. That is not normal. You want a bladder that is smooth as a baby's bottom. And remember, Trabeculations, which are those thickened bladder muscle fibers of the detrusor muscle, that's the name for the bladder muscle, detrusor, we do not want to see these lines. And we can see that here again. These are the lines that we do not want to see. We want it to be smooth and pink and healthy. Quick pause because this matters. This channel is built around one idea. Better bladder health starts with better data for better decision making. If you're a company working with diagnostics, therapeutics, or technologies that genuinely improve how we evaluate and manage and protect the bladder, there's an opportunity to become a founding partner of BPH 360. Not to advertise, but to help move the standard of care forward through education. Now let's get back to the episode. So what do you do with the 5 stages of bladder health? Well, first, do not self-diagnose too confidently. This is a framework using your symptoms, which is your bladder talking to you. We're trying to get an idea of where you are in these progressive stages of disease that we most commonly see in most men with prostatic bladder obstruction, BPH. This linguistic framework is meant to really help you understand the pattern of disease, not replace a real evaluation. You need your data to help you understand exactly what is going on. Second, figure out what symptoms you really have. An easy way to do that is with the Man vs. Prostate Symptom Score. We call it the IBPSS, International Bladder Prostate Symptom Score. It helps categorize your symptoms to help you understand where you might be in the staging symptoms. Are you stage 1 with signs of your prostate donut hole getting too tight. Things are slowing down. It takes more time to start your urine. Your urine is kind of starting and then slowing down, starting and slowing down, called intermittency. Then stage 2, the storage symptoms, urgency, frequency, nocturia. Then stage 3, are you leaking when you can't get to the bathroom in time, requiring you to use absorbent pads or diapers, for example? Or stage 4, have you had an episode where you had to go to the emergency room because you were unable to pass your urine? Start to match your symptoms to the staging system, and now you have a way to communicate with your urologist or your primary care doctor when you ask, what about my bladder? Or I also think, Doc, I might be in stage 3 already. What data do we need to figure out what's going on? Because I really don't want to get to stage 4 and 5 where I can't pee and pass my urine, or even my bladder starts to fail and I need catheters for the rest of my life. Stop normalizing your symptoms. These symptoms are indicative of your bladder pleading for help, talking to you, saying, please go seek someone's advice, talk to a doctor, talk to a urologist, get your data. And just because these symptoms are common amongst men as they get older, it does not mean that it's healthy or that it's okay. These symptoms can really directly impact your quality of life. You need to be living the best version of your life, the last chapters of your life in a healthy way, without leakage, without getting up multiple times at night. This is a very important part of your life, living, your health span, and your bladder span, the number of years that you get to live with a healthy bladder. Fourth, when you're asking about your symptoms with your doctor, you're also asking, hey doc, where do you think my bladder is on this curve of progression? Is it in the earlier stages? Is it in the late stages? Also, I want you to hesitate before you just simply ask, what drug can I take? I also want you to think about, what data do I need? What data do we need as a team with you and your doctors to figure out what are the best management strategies? What is the best plan? What's the best treatment options to manage, treat both the prostate and your bladder so you can have the best quality of life? And fifth, understand that earlier action may preserve more of your bladder function because you have more options the earlier you tackle this problem. Now, we're not saying that every person needs to just jump to surgery or a procedure. When we identify the issues early, we can then get the data early to help you make decisions at the right time to preserve your bladder function before the onset of damage or before the damage is irreversible. Every symptom does not mean a disaster is impending, but timing does matter. So please listen to your bladder when it's talking to you saying, hey, I need help. Get your data so you can make those decisions even better, even faster to preserve your bladder health. The goal is to be able to intervene within that window of curability. If we deobstruct that main water pipe early enough, your bladder can fully recover, or recover enough to give you the best quality of life. A key takeaway is that your symptoms could be a reflection of you moving through an expected progression that we see with this disease of BPH, PBO, prostatic bladder obstruction. These symptoms are not just simply random. And remember, worst case scenario, unlike the heart, you cannot transplant your bladder. And this is a permanent problem that can prevent you from living the best version of your life, incontinence-free and catheter-free. Now that you've seen the 5 stages of bladder health, I do hope that helps. You can go to Man vs. Prostate. We have the IBPSS symptom score, so you can kind of start to categorize those symptoms into voiding subscore stage 1, storage subscore stage 2. Are you leaking stage 3? Have you had a situation where you can't pass urine stage 4? This can help you start the process of understanding where you are in this disease progression. There's also other tools there that can help you understand your bladder health. So we'll see you on the next one. Until then, take care. Bye. Thanks for watching. If bladder health matters to you, watch more. Follow BPH 360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.